Hello, my name is Brittany. Welcome to my PIDP 3240 Pecha Kucha project. This project is on my integration testing for the practical nursing program at VCC Level 1. We will be going over exactly what is required to be successful in this testing process. Integration testing is a skills test at the very end of the semester. It involves all the skills you've worked so hard on up until this point. Let's go through a rundown for what is expected for you to be successful and move on to the clinical setting. Just like in a real-world situation, you should first introduce yourself and explain what is about to happen. Explain that you are about to do an assessment, bed bath, and get the person up and ready for the day. Before doing any procedure, you should also provide privacy by pulling the curtains closed. Always remember to wash your hands. This will be a recurrent theme throughout your entire skills assessment and something we will be looking for. Keep your own hand sanitizer in your pocket to save yourself time. Walking back and forth to the end of the bed for sanitizer can leave your client vulnerable and waste valuable minutes. Then you're able to get going into your main nursing assessment. You need to make sure you are checking their airway, breathing, and circulation. Is the airway patent? Is the breathing normal? Is the circulation adequate? You can then move on to level of consciousness and orientation. Continuing with your QPA, move into any ins and outs. Is there any oxygen tubing or IVs going in? Alternatively, is there a Foley or any wounds that are draining that would be included as an out? Then you can move into a complete pain assessment, PQRST. Depending on your client's case study, make a decision for any focused assessments you would like to do. This could include a chest assessment for COPD, an abdominal assessment for someone with constipation, or a Foley and urine assessment for a renal failure patient. Once you're finished with your assessment and determine there are no immediate issues, you can leave and get your supplies for the bed bath. Just make sure you're doing a safety check before you leave. Bed should be lowest position, bed rails up, bed breaks on, and again, wash your hands. Now you can gather your supplies. You're going to need a basin, soap, gloves, towels, or bed bath wipes, depending on what your facility has available. Being organized here will save you from needing to leave the bedside later. Coming back to the bedside, make sure you raise the bed to working height and you can begin the bed bath. Start with the eyes and face with no soap and then add soap after. Move from clean to dirty principles. If your patient has any weakness on a particular side, make sure you start with their unaffected side first. While you're doing a bed bath, make sure you complete a skin assessment at the same time. Washing someone provides a great opportunity to look at their entire skin for any redness, drying, or skin breakdown that will need to be documented later. Once the client is clean, you can begin to dress them with their clothes. Remember, if the person has a weak side, you'll want to dress that side first to reduce any strain. Now you're ready to get them up and going. We just have to make sure they're able to stand first. Before mobilizing anyone, you'll need to perform a transfer assessment. This includes having someone bridge their hips like the above picture, assessing their grip strength, and whether they are able to stand unassisted at the side of the bed. If any of the answers to these questions are no, they will need to be a full lift. Once you've assessed what kind of lift they require to get up, you will need to leave your patient safely and retrieve the proper sling and appropriate lift. Please do a safety check here and make sure there are no rips or tears on the sling that you have chosen. If your client requires any type of lift, make sure you position the lift safely under them. If a patient can roll to one side, have them hold onto the rail while you line the center of the sling with their spine. Otherwise, you can ask a colleague for help with stabilizing the patient. Before lifting, complete your safety checks. Is the sling positioned properly? Are the straps attached at equal level with no twisting? Is the client's head supported? Are the leg straps crossed with no bunching? And finally, does the client have their shoes on? Make sure the brakes are off on the lift and we're ready to go. Please do not drag the person's heels or sacrum across the bed, as this can cause skin tears and fragile skin. Position safely above the wheelchair, and with the help from your partner, slowly lower the patient down. Once you have lowered the patient into the wheelchair, perform the following posture checks. Are the shoulders, hips, and knees in alignment? Is the lower back flush against the back of the chair? These checks help to prevent pain in patients who are more immobile. To finish up with your assessments, complete an oral assessment using a tongue depressor. Make sure to check the person's lips, gums, teeth, and tongue, and please verbalize what you are seeing. Then you can assist with brushing their teeth. Before sending the patient out to breakfast, complete any last-minute grooming. This can include brushing their hair or putting on makeup or jewelry. This is anything that the patient requests and may require help with to make them feel like themselves. Then you can wheel them out for breakfast. Your integration testing is now complete. Please take a few minutes to tidy up your area and complete an honest self-evaluation with how you feel you did. For the entire testing process, you will have 40 minutes to complete the above scenario. These are the references that I used for the photos and the knowledge portion for VCC Practical Nursing Department. Thank you very much.